Marcus Williams felt the pain start during dinner. At first, it was just a small ache in his stomach. He thought maybe the food was not sitting well. But within an hour, the pain grew worse. Much worse. It felt like someone was stabbing him in the side with a hot knife. He could barely stand up straight. His wife Lisa watched him with worried eyes. She was 7 months pregnant and her hands rested on her round belly as she stood up from the dinner table. "Marcus, you look terrible. We need to go to the hospital." Marcus wanted to say no. He was a 34-year-old architect with a big project due next week. He did not have time to be sick. But the pain was so bad that he could not argue. He nodded and let Lisa help him to the car. The drive to St. Augustine Medical Center took 15 minutes. Every bump in the road made Marcus groan. He pressed his hand against his right side, trying to make the pain stop. It did not work. By the time they reached the emergency room entrance, sweat covered his face even though the night air was cool. Lisa helped him out of the car and through the automatic doors. The emergency room was busy. People sat in chairs waiting their turn. Some looked sick. Others looked bored. A baby was crying somewhere in the corner. The fluorescent lights were too bright and made everything look harsh and cold. They walked up to the reception desk. A middle-aged woman with glasses looked up at them. "Name and reason for visit?" "Marcus Williams. He has terrible pain in his stomach," Lisa said quickly. "It started a few hours ago and keeps getting worse." The receptionist handed them forms to fill out. Marcus could barely hold the pen. His hand shook as he tried to write his name. Lisa took the pen from him and filled out the forms herself while Marcus leaned against the desk, breathing hard. A nurse called them back after 10 minutes. Her name tag said Jennifer Parks. She had kind eyes and moved with the confidence of someone who had done this job for many years. She led them to a small examination room and helped Marcus onto the bed. "Tell me about your pain," Nurse Parks said as she wrapped a blood pressure cuff around his arm. "It is on my right side. Down low," Marcus said through gritted teeth. "It hurts so bad I can barely think." Nurse Parks pressed gently on his stomach. When she touched the lower right side, Marcus cried out. She nodded to herself, her face serious. "When did you last eat?" "About 2 hours ago. We had chicken and rice." She checked his temperature and pulse. Then she made notes on her computer. "I am going to call the doctor. Your symptoms look like appendicitis. That is serious and needs quick treatment." Lisa grabbed Marcus's hand. "Is he going to be okay?" "The doctor will examine him and decide what to do next," Nurse Parks said. She gave Lisa a reassuring smile, but her eyes showed concern. "I will be right back." Marcus lay on the examination bed staring at the ceiling tiles. The pain kept getting worse. He had never felt anything like this before. Not when he broke his arm as a kid. Not when he had the flu last year. This was different. This felt dangerous. 15 minutes passed, then 20. Marcus moaned and shifted on the bed, trying to find a position that hurt less. There was no such position. Lisa stood beside him, stroking his hand and whispering that everything would be okay. But her voice shook when she spoke. Finally, the door opened. A tall white man in a white coat walked in. He was in his early 50s with gray hair at his temples and sharp blue eyes. His name tag identified him as Dr. Richard Hartwell, head of emergency medicine. He carried a tablet computer and barely looked at Marcus as he entered. "So what seems to be the problem?" Dr. Hartwell asked, his eyes on the tablet screen. "My husband has terrible pain in his side," Lisa said. "The nurse thinks it might be appendicitis." Dr. Hartwell finally looked up. His eyes moved from Marcus to Lisa and back again. Something changed in his expression. It was subtle. Just a tiny shift in his features. But Marcus noticed it. So did Lisa. Dr. Hartwell said. He walked over to the bed slowly, as if he was not in any hurry. "Show me where it hurts." Marcus pointed to his lower right side. "Right here." It started small, but now it is unbearable. Dr. Hartwell barely touched him. His hand hovered over Marcus's stomach for maybe 3 seconds, pressing so lightly that it was almost not a real examination. He stepped back quickly. "Did you eat something unusual tonight?" Dr. Hartwell asked. "No, just regular food. Chicken and rice. The same food my wife ate and she is fine." "Spicy food can cause stomach upset," Dr. Hartwell said, making notes on his tablet, "especially if you are not used to it." "It was not spicy," Marcus said, confusion mixing with his pain. "And this is not stomach upset." "This is real pain. Bad pain." Dr. Hartwell waved his hand dismissively. "Pain is subjective. What feels like severe pain to one person might be moderate discomfort to another." At the door, Nurse Parks appeared with another doctor. This one was a young Asian woman, maybe in her late 20s. Her name tag said Dr. Sarah Chen, resident. She held a chart and looked at Marcus with concerned eyes. Dr. Hartwell, I reviewed the patient's vitals and symptoms, Dr. Chen said carefully. His temperature is elevated, his white blood cell count is high, and he has rebound tenderness in the right lower quadrant. These are classic signs of acute appendicitis. Should we order a CT scan? Dr. Hartwell turned to her with an annoyed expression. Dr. Chen, you have been a resident for what, 6 months? 8 months, sir. 8 months. I have been practicing emergency medicine for 25 years. I think I know the difference between appendicitis and food poisoning. His voice was cold and sharp. This patient has gastric distress from dietary indiscretion. Nothing more. Dr. Chen opened her mouth to argue, then closed it. Marcus saw the frustration in her eyes, but she was too junior to push back against the head of the department. But doctor, Lisa said, stepping forward, my husband is in real pain. He has never been sick like this before. Should we not do more tests just to be sure? Dr. Hartwell looked at her with barely concealed impatience. Mrs. Williams, I understand you are worried, but we cannot run expensive tests on every patient who comes in with a stomachache. The emergency room would be backed up for days. Your husband has food poisoning. He needs rest and fluids. I will prescribe some pain medication and an anti-nausea drug. He will feel better by tomorrow. How can you be sure? Marcus asked. The pain made his voice weak. Because I have seen thousands of cases like this, Dr. Hartwell said firmly. He was already typing on his tablet, entering prescriptions. Take these medications. Go home. Drink plenty of water. If you are not feeling better in 2 days, see your primary care doctor. But I am confident this will pass. 2 days? Lisa's voice rose. What if it gets worse tonight? It will not get worse. It is already improving, I am sure. The pain probably peaked an hour ago. Dr. Hartwell finished his notes and headed for the door. Nurse Parks will give you the discharge papers and prescriptions. Good luck. He left the room. Dr. Chen lingered for a moment, looking at Marcus with troubled eyes. Then she too left, following her superior. Nurse Parks came back with papers. She looked upset but said nothing. She helped Marcus sit up slowly. The movement sent fresh waves of pain through his body. Are you sure we should go home? Lisa asked the nurse quietly. Nurse Parks glanced at the door, then back at Lisa. Her voice was low when she spoke. I have to follow doctor's orders. But if things get worse, come back immediately. Do not wait. They made their way slowly through the emergency room. Marcus had to stop twice because the pain was so intense. Other patients stared at them. Lisa supported her husband as best as she could while carrying her pregnant belly. They reached the waiting area. Marcus felt dizzy. The room started to spin. His legs felt weak. He tried to tell Lisa something was wrong, but the words would not come out right. Then the floor rushed up to meet him. Marcus collapsed. His body hit the tile floor hard. Lisa screamed. People jumped up from their chairs. Somewhere an alarm started ringing. Footsteps pounded toward them. The last thing Marcus heard before everything went dark was Lisa crying out his name. The sound of the alarm brought medical staff running from all directions. Dr. Sarah Chen was the first to reach Marcus. She dropped to her knees beside his unconscious body and immediately checked his pulse. It was fast and weak. His skin felt hot to the touch. Get a gurney now, Dr. Chen shouted. And page surgery. This patient is critical. 2 nurses rushed over with a wheeled bed. They carefully lifted Marcus onto it. Lisa stood nearby, her hands pressed against her mouth, tears streaming down her face. She looked like she might faint herself. Ma'am, please sit down, Nurse Parks said gently, guiding Lisa to a chair. Let them work. Dr. Chen ran alongside the gurney as they pushed Marcus back into the emergency area. This time they took him to a trauma bay, not a regular examination room. Machines beeped as nurses hooked him up to monitors. His blood pressure was dropping. His heart rate was climbing. Where is Dr. Hartwell? One of the nurses asked. I do not have time to find him, Dr. Chen said, her hands moving quickly as she examined Marcus. This patient needs a CT scan immediately. His appendix is likely ruptured. Call radiology and tell them we are coming up now. Should we wait for Dr. Hartwell to approve it? The nurse asked nervously. Dr. Chen looked up, her eyes fierce. If we wait, this patient could die. I am ordering the scan. Now move! The staff responded to the authority in her voice. They wheeled Marcus toward the elevators. Dr. Chen stayed with him the whole way, monitoring his vitals. She knew she was taking a risk by going against Dr. Hartwell's diagnosis. He was her superior. He could make her life very difficult. But she had taken an oath to help people, and Marcus needed help right now. The CT scan took 20 minutes. Dr. Chen stood in the viewing room, watching the images appear on the screen. What she saw made her stomach drop. Marcus's appendix had not just ruptured. It had burst completely. Infection was spreading through his abdomen. This was peritonitis, a life-threatening condition. She grabbed her phone and called the surgical department. "This is Dr. Chen from emergency. I have a patient with a ruptured appendix and peritonitis. He needs surgery immediately. How fast can you get a team ready?" 20 minutes, the voice on the other end said. "Bring him up to OR3. Dr. Chen ran back to where Marcus lay. He was semi-conscious now, moaning in pain. She leaned close to him. "Marcus, can you hear me? You are going into surgery. We are going to fix this." His eyes opened slightly. He tried to speak but could not form words. "Where is my husband?" Lisa's voice came from the doorway. Nurse Parks had brought her up to see him before surgery. Dr. Chen turned to face her. "Mrs. Williams, your husband's appendix has ruptured. He has a serious infection in his abdomen. We are taking him to surgery right now." Lisa's face went pale, but Dr. Hartwell said it was just food poisoning. He said Marcus would be fine. Dr. Hartwell was wrong. Dr. Chen said quietly but firmly, "I am so sorry this happened. We should have caught this earlier, but we are going to do everything we can to help him now." "Is he going to die?" Lisa whispered. Dr. Chen could not lie to her. "He is very sick, but we have good surgeons here. They will do their best." They wheeled Marcus toward the operating room. Lisa walked beside the gurney, holding his hand. At the doors to the surgical area, she had to let go. She watched as they pushed her husband through the double doors, not knowing if she would see him alive again. Nurse Parks led Lisa to the surgical waiting room. It was a small space with uncomfortable chairs and old magazines. A coffee machine hummed in the corner. Lisa sat down heavily, her hands shaking. "Can I call someone for you?" Nurse Parks asked. "Family, friends?" Lisa shook her head. "Our families live in other states. It is just us here." Nurse Parks sat down beside her. She should have gone back to work, but something made her stay. After 20 years as a nurse, she had learned to trust her instincts. And her instincts told her something was very wrong about this whole situation. "Mrs. Williams," Nurse Parks said carefully, "when your husband first came in, what did Dr. Hartwell do exactly? Did he examine him thoroughly?" Lisa thought back. "No, he barely touched Marcus. Maybe for 3 seconds. Then he said it was food poisoning." Nurse Parks nodded slowly. A sick feeling grew in her stomach. She had worked with Dr. Hartwell for many years. He was a skilled doctor, or at least she had always thought so. But now that she thought about it, she remembered other times when he had seemed to dismiss patients quickly. She had noticed it before, but never really paid attention to the pattern. Most of those patients had been black. The thought made her feel ashamed. How had she worked here for 2 decades and never really seen it? Or had she seen it and just looked away because it was easier than causing trouble? "I need to make a phone call," Nurse Parks said, standing up. "Will you be okay for a few minutes?" Lisa nodded, staring at the wall. Nurse Parks went to a quiet hallway and called Dr. Chen's cell phone. The young doctor answered on the second ring. "Dr. Chen, this is Jennifer Parks from the ER. We need to talk about Dr. Hartwell and the Williams case." "I know," Dr. Chen said. Her voice sounded tired and angry. "I have been thinking about it too. That was not a simple misdiagnosis. He barely looked at that patient." "It is not the first time," Nurse Parks said quietly. "I have been thinking back. There have been other cases, other black patients that he seemed to dismiss or not take seriously." There was silence on the other end of the line. Then Dr. Chen spoke. "Are you sure?" "I am not certain, but I think so. And I think we need to report this." "If we do that, we could lose our jobs," Dr. Chen said. "Dr. Hartwell has power in this hospital. He has friends on the board." "I know, but that man in surgery right now almost died because Dr. Hartwell would not do his job properly. What if there are others? What if people have died?" Nurse Parks felt her voice shaking. "I cannot stay quiet anymore. Not after tonight." Dr. Chen was quiet for a long moment. Then she said, "Okay, after the surgery, we talked to the hospital administration. Together. We tell them everything. Together, Nurse Parks agreed. Meanwhile, in another part of the hospital, Dr. Hartwell sat in his office. He had heard about Marcus collapsing. He had heard about the emergency CT scan and the surgery, and he was updating his medical notes on the computer. His fingers moved quickly over the keyboard. He wrote that Marcus had presented with abdominal pain, but that his symptoms had been vague and could have indicated several different conditions. He wrote that he had performed a thorough examination and found no clear signs of appendicitis at the time. He wrote that the patient's condition deteriorated rapidly and unexpectedly. He did not mention that he had barely touched Marcus. He did not mention that Dr. Chen had suggested appendicitis and that he had dismissed her. He made it sound like he had done everything correctly, and that Marcus's collapse was simply an unfortunate turn of events that no one could have predicted. When he finished, Dr. Hartwell leaned back in his chair. He felt annoyed. That young resident, Dr. Chen, was too quick to question his decisions, and the patient's wife had been pushy and demanding, but he had covered himself. His notes showed he had followed proper procedure. If anyone asked questions, he had his documentation to prove he had done nothing wrong. He did not think about Marcus lying on an operating table, fighting for his life. He did not think about Lisa sitting in the waiting room, terrified and alone. He thought about protecting himself. The surgery lasted 3 hours. The surgeon, Dr. James Park, worked carefully to clean out the infection from Marcus's abdomen. The ruptured appendix had been spewing bacteria and pus into his body cavity for hours. The damage was extensive. When Dr. Park finally emerged from the operating room, he looked exhausted. He pulled off his surgical mask and went to find Lisa in the waiting room. Dr. Chen and Nurse Parks were with her now, keeping her company. "Mrs. Williams?" Dr. Park said. Lisa jumped to her feet. "How is he?" "Is he alive?" "Your husband is alive," Dr. Park said. "But he is very sick. The infection spread throughout his abdomen. We removed his appendix and cleaned out as much infection as we could, but he has developed sepsis. That is when infection spreads through the bloodstream. We are treating him with strong antibiotics, but the next few days will be critical. Can I see him?" "Soon. He is in recovery now, then we will move him to the intensive care unit. You can see him there." Dr. Park's expression was serious. "Mrs. Williams, I need to be honest with you. Your husband is not out of danger yet. Sepsis is very serious. We will do everything we can, but I cannot make you any promises." Lisa sank back into her chair. Her hand went to her pregnant belly. How was she supposed to deal with this? How was she supposed to stay strong when the father of her unborn child was fighting for his life? Dr. Park turned to Dr. Chen. "I want to know why this patient was not diagnosed correctly in the ER. His appendix had been inflamed for hours before it ruptured. Someone should have caught this earlier." "I tried to," Dr. Chen said. "Dr. Hartwell overruled me." Dr. Park's eyebrows went up. "Hartwell? He is usually very thorough. What happened?" Dr. Chen and Nurse Parks exchanged glances. "We are not sure," Dr. Chen said carefully. "But we plan to file a report with the administration tomorrow." "Make it today," Dr. Park said. "That man in the ICU almost died tonight. If his appendix had been removed when he first came in, he would be fine now. Instead, he has sepsis and might still die. Someone needs to answer for that." 2 hours later, Marcus was moved to the intensive care unit. He lay in a bed surrounded by machines. Tubes ran into his arms. A ventilator helped him breathe. His eyes were closed and his face was gray. Lisa sat beside him, holding his hand. She talked to him even though he could not hear. She told him about the baby, about how they had already picked out a name. Amara. It meant grace and mercy. She needed him to live. Their daughter needed her father. In the hospital administration office, Dr. Chen and Nurse Park sat across from Margaret Foster, the director of patient services. They told her everything, about Dr. Hartwell barely examining Marcus, about him dismissing the symptoms of appendicitis, about him refusing to order proper tests even when Dr. Chen suggested it. And then Nurse Parks told her about the pattern she had noticed over the years. Other black patients who seemed to receive less thorough care from Dr. Hartwell. Margaret Foster listened with a grave expression. When they finished, she said, "These are serious accusations. Do you understand what you're saying? You are accusing one of our most senior doctors of medical negligence, possibly discrimination." "Yes," Dr. Chen said firmly. "That is exactly what we are saying. Margaret Foster picked up her phone. Then we need to begin an investigation immediately. Marcus remained in the intensive care unit for 3 days. His body fought against the infection that had spread through his bloodstream. The antibiotics worked slowly. Some days he seemed better. Other days he got worse. Lisa never left his side except to use the bathroom. She slept in the uncomfortable chair next to his bed. Nurses brought her food, though she barely ate. On the third morning, Marcus opened his eyes. He looked around, confused by all the tubes and machines. His throat hurt from the breathing tube they had removed the night before. "Marcus," Lisa leaned forward, tears already streaming down her face. "Oh, thank God, you are awake." He tried to speak, but his voice came out as a rough whisper. "What happened?" "Your appendix burst. You have been very sick, but you are going to be okay now." Lisa kissed his forehead gently. "You scared me so much." Marcus closed his eyes, trying to remember. He recalled the pain. The emergency room. A doctor who barely looked at him. "Then nothing. The baby?" he whispered. "She is fine. Still kicking. She is a fighter like her daddy." Lisa smiled through her tears. A nurse came in to check Marcus's vital signs. She was kind and gentle, adjusting his pillows and explaining what each machine was monitoring. When she left, Marcus looked at his wife. "How long was I out?" 3 days. "You had surgery. They removed your appendix and cleaned out a bad infection." Lisa hesitated. "Marcus, something was not right about how they treated you when we first came to the hospital. A lawyer called me yesterday. He saw the news story and wants to talk to us." "News story?" "It is on the local news. About what happened to you. About the doctor who sent you home." Lisa's voice hardened. "The doctor who almost let you die." Before Marcus could respond, there was a knock on the door. Dr. Chen entered, looking tired but relieved to see Marcus awake. "Mr. Williams, it is good to see you conscious. How are you feeling?" "Like I got hit by a truck," Marcus said. "That is understandable. You have been through a serious ordeal." Dr. Chen pulled up a chair. "I need to talk to you about what happened when you first came to the emergency room." She told him everything. About how Dr. Hartwell had barely examined him. About how she had suspected appendicitis but was overruled. About how Nurse Parks had noticed a pattern of black patients receiving poor care from Dr. Hartwell. Marcus listened, his anger growing with each word. "So he just decided I was not worth his time." "We cannot prove his motivation yet," Dr. Chen said carefully. "But the hospital is investigating. They are reviewing all his cases from the past 5 years." 5 years, Lisa said. "How many other people did he do this to?" "That is what we are trying to find out." After Dr. Chen left, Lisa pulled out her phone. She showed Marcus the news articles. "Doctor under investigation for possible discrimination," read one headline. "St. Augustine Medical Center reviews ER cases," said another. His picture was in some of the articles taken from his architectural firm's website. "Everyone knows," Marcus said quietly. "Good," Lisa said fiercely. "Everyone should know. What he did to you was wrong. What he might have done to others is wrong. He needs to be stopped." The lawyer, David Park, visited them that afternoon. He was a sharp-dressed man in his 40s who specialized in medical malpractice. He explained that several other former patients had already contacted his office after seeing the news. "There is a woman named Angela Thompson," David said, sitting at the foot of Marcus's bed. 3 years ago, Dr. Hartwell told her that her chest pains were just anxiety. Told her she was stressed and needed to calm down. She had a heart attack in the hospital parking lot 20 minutes later. Paramedics saved her life. "My God," Lisa whispered. "There is more. A young man named Deshaun Miller, car accident victim. Dr. Hartwell barely gave him pain medication, suggested he was drug-seeking. The man had 3 broken ribs and a punctured lung. He suffered for hours before another doctor finally treated him properly." David pulled out more files. Case after case, all black patients. All treated dismissively by Dr. Hartwell. Some had minor consequences. Others nearly died. "How did he get away with this for so long?" Marcus asked. "Because he was careful. He never completely refused treatment. He just did the minimum, and patients often do not question doctors, especially senior doctors with good reputations. Plus, proving discrimination in medical care is very difficult. You have to show a pattern. Until now, no one had connected all these cases together." "What happens now?" Lisa asked. "Now the hospital is doing an internal investigation. The state medical board has also been notified. and I would like to represent you in a civil lawsuit against Dr. Hartwell and the hospital. David looked at Marcus seriously. I will not lie to you. These cases are hard to win, but with the pattern we are seeing, I think we have a strong case. Marcus thought about it. Part of him just wanted to forget this and move on. But another part of him thought about Angela Thompson having a heart attack in the parking lot, about Deshaun Miller suffering with broken ribs, about all the other people who might have been hurt. Okay, Marcus said. Let us do it. Over the next week, more information came out. The hospital's investigation revealed shocking statistics. Over the past 5 years, Black patients treated by Dr. Hartwell in the emergency room were 40% more likely to be sent home without proper testing compared to white patients with identical symptoms. They waited an average of 30 minutes longer to be seen. They received pain medication at significantly lower rates. The hospital released a statement saying they were deeply concerned by these findings and had placed Dr. Hartwell on administrative leave while they conducted a thorough review. The statement apologized to any patients who had received inadequate care, but the damage was done. Local news stations ran stories every night. Protesters gathered outside St. Augustine Medical Center with signs saying Black Lives Matter in healthcare too and our pain is real. Community leaders called for Dr. Hartwell's medical license to be permanently revoked. Dr. Hartwell himself stayed silent at first. His lawyer issued a brief statement saying the accusations were based on misunderstandings and taken out of context. He claimed that Dr. Hartwell had treated thousands of patients of all races with equal care over his long career. But then more stories emerged. Former colleagues spoke anonymously to reporters. They shared incidents of Dr. Hartwell making racist comments in private, jokes about Black patients, assumptions about drug-seeking behavior, comments about certain patients being dramatic or exaggerating their pain. One former nurse described a meeting where Dr. Hartwell had said that some communities had higher pain tolerances and did not need as much medication. Another colleague remembered him saying that certain patients would abuse the system if given the chance. The picture that emerged was ugly. Dr. Hartwell was not just a doctor who made one mistake. He was someone whose prejudices had affected his medical judgment for years, and the hospital had either not noticed or not cared enough to stop it. Meanwhile, Marcus continued to recover slowly. The infection was under control, but his body had been through trauma. He needed another surgery to deal with complications from the widespread infection. His medical bills were already over $200,000. His insurance company was covering most of it, but they had started an investigation into whether the hospital should be held liable for the costs. His architectural firm had been understanding at first. They told him to take all the time he needed, but as weeks passed and the big project deadline approached, Marcus could hear the stress in his boss's voice during phone calls. The project was falling behind. Clients were getting nervous. His team was trying to cover for him, but they needed their lead architect. The stress affected Lisa too. She was in her 8th month of pregnancy now. Her blood pressure started rising. Her doctor warned her about preeclampsia and told her she needed to rest and avoid stress. But how could she rest when her husband was in the hospital, when their finances were uncertain? When reporters kept calling asking for interviews. One evening, Lisa felt a sharp pain in her abdomen. It was different from the baby kicking. This hurt. She was in Marcus's hospital room at the time. She gasped and grabbed the bed rail. Lisa? Marcus tried to sit up but was still too weak. What is wrong? I do not know. Something does not feel right. Lisa's face went pale. Another pain hit her, stronger this time. Marcus reached for the call button. Nurses came running. They took one look at Lisa and called for a wheelchair. Within minutes, they had rushed her to the maternity ward on the 3rd floor. Lisa was going into early labor. The stress had been too much. Her body had decided it was time, 3 weeks before her due date. Marcus lay in his ICU bed, helpless and terrified. He could not go to his wife. He was still too sick to be moved. Nurses promised to keep him updated, but it was not the same as being there. Downstairs in the hospital lobby, Dr. Hartwell's lawyer held a press conference. The lawyer announced that Dr. Hartwell denied all accusations of discrimination. He claimed that the statistical differences in patient care were coincidental and could be explained by various factors. He said his client was the victim of a rush to judgment and that his reputation was being destroyed unfairly. Dr. Hartwell has devoted his life to helping people, the lawyer said into the cameras.
He has saved countless lives.
These accusations are part of a politically motivated witch hunt. My client looks forward to clearing his name. But even as the lawyer spoke, the state medical board was reviewing files. They had found more than 30 cases where Dr. Hartwell's treatment of black patients appeared questionable. Some were minor, but others were serious. 2 patients had suffered permanent injuries that might have been prevented with proper care. 1 elderly woman had died from a misdiagnosed stroke. The board scheduled an emergency hearing. Dr. Hartwell's medical license was suspended temporarily, pending the outcome of the investigation. When Dr. Hartwell heard the news, he sat in his expensive home office staring at the wall. Everything was falling apart. His wife had barely spoken to him in days. His adult children kept calling, asking if the accusations were true. His colleagues avoided him. The hospital had locked him out of his office and email account. He told himself he was the victim here. He had done nothing wrong. So what if he had been a little dismissive of some patients? Doctors had to make quick judgments. They could not spend an hour on every case. He had been efficient, not discriminatory, but deep down in a place he did not want to look, he knew the truth. He had made assumptions about patients based on their race. He had let his prejudices affect his medical decisions, and people had been hurt because of it. Upstairs in the maternity ward, Lisa gave birth to a baby girl. Amara Williams came into the world 3 weeks early but healthy. She weighed 6 pounds and had a full head of black hair. She cried loudly, announcing her arrival to the world. The nurses wrapped Amara in a pink blanket and placed her in Lisa's arms. Lisa looked down at her daughter through tears of joy and exhaustion. "You are here," Lisa whispered. "You are finally here." A nurse took photos on Lisa's phone so Marcus could see. They wheeled Lisa and the baby down to the ICU so Marcus could meet his daughter. Hospital rules said babies were not allowed in the ICU, but the staff bent the rules this once. When Marcus saw his daughter for the first time, he cried. He reached out with a shaking hand and touched her tiny fingers. She grabbed his finger and held on tight. "She is perfect," Marcus said. "She is absolutely perfect." Lisa brought the baby closer so Marcus could see her better. "She looks like you." "Poor kid," Marcus joked weakly, but his eyes never left his daughter's face. For a moment, all the pain and anger and fear faded away. There was just this perfect little person, new to the world, depending on them. Marcus made a silent promise to his daughter. He would fight to get better. He would make sure what happened to him never happened to anyone else. He would make the world a little bit better for her. But first he had to heal, and the road to recovery was going to be long. The hospital investigation took 6 weeks to complete. During that time, the Medical Review Board examined over 400 cases that Dr. Hartwell had handled in the past 5 years. They brought in outside experts to review his decisions and compare his treatment of patients across racial lines. The results were damning. The experts found clear evidence of racial bias in Dr. Hartwell's medical decisions. Black patients received less thorough examinations, waited longer for care, and were sent home with inadequate treatment at significantly higher rates than white patients with identical symptoms. But the investigation revealed something even more troubling. Several staff members had filed informal complaints about Dr. Hartwell's behavior over the years. These complaints had been noted but never seriously investigated. The hospital administration had failed to act on warning signs because Dr. Hartwell was a senior doctor with a strong reputation and connections to the hospital board. Margaret Foster, the director of patient services, had to face a difficult truth. The system had protected Dr. Hartwell instead of protecting patients, and she had been part of that system. The hospital called a press conference. The CEO, Robert Chen, stood at a podium in front of dozens of cameras. He looked uncomfortable in his suit and tie. "After a thorough investigation, we have concluded that Dr. Richard Hartwell violated our standards of care in multiple cases," Robert Chen read from a prepared statement. "We have terminated his employment effective immediately. We have also referred this matter to the State Medical Board for further action." Reporters shouted questions. How many patients were affected? Why was this not caught sooner? Will the hospital face legal consequences? Robert Chen held up his hand. "We are still identifying all affected patients. We will be reaching out to offer support and compensation where appropriate. As for why this was not caught sooner, that is a question we are asking ourselves. We have failed in our duty to protect patients. For that, I am deeply sorry." The apology felt hollow to many people. Sorry did not fix the harm that had been done. Sorry did not give Angela Thompson back the years she lost recovering from her heart attack. Sorry did not erase Deshaun Miller's suffering with broken ribs. And sorry definitely did not undo what happened to Marcus Williams. Marcus had been released from the hospital after 4 weeks. He was still weak and needed help with basic tasks. He had lost 20 pounds. His skin had a grayish tone. He moved slowly, like an old man instead of a 34-year-old in his prime. At home, Lisa tried to care for both her husband and their newborn daughter. It was overwhelming. Amara needed feeding every 3 hours. Marcus needed help getting to the bathroom, getting dressed, managing his medications. Lisa ran on no sleep, coffee, and pure determination. Her mother flew in from across the country to help. Having another set of hands made things easier, but the emotional weight remained. Every time Lisa looked at Marcus struggling to do simple things, she felt anger rise in her chest. He should not be like this. He should be healthy and strong, going to work, playing with his daughter. Instead, he spent most of his days on the couch, trying to regain his strength. The bills kept coming. Medical bills, prescription costs, home health care. Marcus's insurance covered 80%, but 20% of hundreds of thousands of dollars was still a fortune. Their savings were disappearing fast, and Marcus's job situation was getting worse. His firm had been patient, but they could not hold his position forever. They needed someone who could work full-time. After 6 weeks, they called with bad news. "Marcus, we have to hire someone to replace you on the project," his boss Daniel said over the phone. His voice was apologetic but firm. "We cannot wait any longer. The client is threatening to go with another firm." "I understand," Marcus said, even though his heart was breaking. "What about when I get better? When you are ready to come back full-time, we will talk. But right now we need someone healthy." There was a pause. "I am sorry, Marcus. I really am. But this is business." After the call ended, Marcus sat on the couch staring at nothing. He had worked at that firm for 8 years. He had poured his heart into that project. And now it was being given to someone else. Lisa found him there an hour later, still staring. "What happened?" he told her. She sat down beside him and took his hand. Neither of them said anything for a long time. What was there to say? Their world had been turned upside down by one doctor's prejudice and one hospital's failure to act. Meanwhile, more former patients were coming forward. Angela Thompson agreed to be interviewed on the local news. She sat in her living room telling her story to a sympathetic reporter. "I knew something was wrong," Angela said. She was 52 years old, a schoolteacher with kind eyes. "I had never had chest pain like that before. But Dr. Hartwell looked at me like I was wasting his time. He said I was having a panic attack. Told me to breathe deeply and go home." The reporter leaned forward. "What happened next?" "I made it to my car. The pain got worse. I thought I was dying. I could not breathe." Angela's voice shook. "Some teenagers in the parking lot saw me collapse. They called 911. The paramedics said if they had arrived 5 minutes later, I would be dead. Did you file a complaint?" I tried. But the hospital said it was a judgment call. Said doctors cannot be right 100% of the time. Angela looked directly at the camera, but the paramedic told me my symptoms were classic heart attack signs. Any ER doctor should have known. Dr. Hartwell should have known. He just did not care enough to look properly. The interview went viral. Thousands of people shared it on social media. The comments were filled with similar stories from around the country. Black patients dismissed by doctors. Pain not taken seriously. Symptoms ignored. It was a national problem, and Dr. Hartwell's case had become a symbol of it. Deshaun Miller also came forward. He was 26 years old, a construction worker with a wife and baby son. He described going to the emergency room after a bad car accident. "My chest was killing me," Deshaun said. "I could barely breathe. But Dr. Hartwell acted like I was there to score pain medication. He kept asking me about drug use. Kept asking if I had a history of substance abuse. Man, I had never done drugs in my life. I just needed help." Deshaun had ended up waiting 4 hours before another doctor took him seriously. By then, his punctured lung had partially collapsed. He needed emergency surgery and spent a week in the hospital. "I have permanent lung damage now," Deshaun said. "I cannot do heavy construction work anymore. I had to switch to a desk job that pays half what I used to make. All because that doctor made assumptions about me based on how I look." David Park, the lawyer, was now representing 15 former patients. He filed a class action lawsuit against both Dr. Hartwell and St. Augustine Medical Center. The lawsuit claimed medical negligence, discrimination, and institutional failure to supervise. The hospital's insurance company reached out about settlements. They wanted to avoid a lengthy public trial, but David advised his clients to be patient. "They will offer you money to go away quietly," he told Marcus and Lisa during a meeting at their home. "But if we go to trial, we can get more. And more importantly, we can put everything on public record. We can make sure this never happens again." "How long would a trial take?" Lisa asked. She was holding Amara, who had fallen asleep on her shoulder. "Could be a year, maybe longer." David looked at them seriously. "I will not lie to you. Trials are stressful. They will bring up every detail of your medical history. Dr. Hartwell's lawyers will try to make it seem like Marcus was partly to blame. They will say he should have insisted on more tests, should have come back sooner. It will not be pleasant." Marcus and Lisa looked at each other. They had that silent communication that couples develop over years together. They did not need words to know what the other was thinking. "We will go to trial," Marcus said. "This is bigger than just us now." While the lawsuit moved forward, the state medical board held its hearing on Dr. Hartwell's license. The hearing room was packed with patients, reporters, and concerned citizens. Dr. Hartwell sat at a table with his lawyer, wearing an expensive suit and an expression of wounded dignity. The medical board presented their findings. Case after case of questionable treatment, statistical evidence of racial disparities, testimony from former colleagues about racist comments. Dr. Hartwell's lawyer argued that his client was being judged unfairly. He brought in expert witnesses who said that emergency medicine required quick decisions and that some variance in treatment was normal. He claimed the statistical differences could be explained by factors other than race. But then Angela Thompson testified. She described her heart attack. She showed medical records proving her symptoms had been textbook signs of cardiac arrest. She looked directly at Dr. Hartwell as she spoke. "You did not even check my blood pressure," she said. "You did not do an EKG. You barely listened to my heart. You decided what was wrong with me before you even examined me, and I almost died because of it." Dr. Hartwell stared at the table. He did not meet her eyes. Deshaun Miller testified next. Then 3 other patients. Each told similar stories of dismissal and inadequate care. Finally, Marcus was called to testify. He walked slowly to the witness chair, still visibly weak. Lisa sat in the audience holding Amara, watching her husband with worried eyes. Marcus described his experience in detail. The terrible pain, Dr. Hartwell's cursory examination, being sent home, collapsing in the waiting room, waking up days later to learn his appendix had burst. "I am an educated man with good insurance," Marcus said. "I speak clearly. I dress well." And still Dr. Hartwell looked at me and decided my pain was not real. If it happened to me, how many others were there? People without insurance? People who could not afford lawyers? People who just suffered in silence because they thought that was how things were? The hearing lasted 3 days. At the end, the medical board deliberated for 4 hours. When they returned, the chairman read their decision. The board has determined that Dr. Richard Hartwell failed to meet the standard of care expected of a licensed physician. His treatment of patients showed clear evidence of racial bias that affected his medical judgment. Furthermore, his actions put patients at serious risk of harm and in some cases resulted in actual harm. The chairman paused and looked at Dr. Hartwell. "Dr. Hartwell, your medical license is hereby revoked permanently. You are prohibited from practicing medicine in this state or any other state. This decision is effective immediately." The room erupted. Some people cheered. Others gasped. Reporters rushed out to file their stories. Dr. Hartwell sat frozen in his chair, his face pale. His lawyer put a hand on his shoulder and said something quietly, but Dr. Hartwell did not respond. He just stared straight ahead, looking like a man who had just watched his entire life crumble. Outside the hearing room, Angela Thompson hugged Marcus. Deshaun shook his hand firmly. They had won this battle. Dr. Hartwell would never hurt another patient. But the victory felt hollow to Marcus. His health was still damaged. His career was still in jeopardy. His family was still struggling financially. Getting justice did not undo the harm that had been done. On the drive home, Lisa reached over and squeezed Marcus's hand. "One step at a time," she said. "We are moving forward. That is what matters." Marcus nodded, but he felt exhausted. The fight was far from over. There was still the lawsuit, still his recovery, still the need to rebuild his life and career, and somewhere out there in other hospitals and clinics, other doctors like Hartwell were still practicing. Other patients were being dismissed and harmed. The problem was bigger than one man or one hospital, but today at least there was this small measure of justice. It would have to be enough for now. The months following the medical board hearing were some of the hardest of Marcus's life. His physical health slowly improved, but the recovery was frustrating and painful. He had to relearn how to do things he used to take for granted. Walking upstairs left him breathless. Carrying his daughter for more than a few minutes made his abdomen hurt. Physical therapy helped, but progress came in tiny steps rather than leaps. Some days Marcus felt encouraged. Other days he wanted to give up. The man he used to be felt like a distant memory, that Marcus could work 12-hour days, go to the gym, play basketball on weekends. This Marcus got tired walking to the mailbox. The financial pressure made everything worse. The medical bills kept coming even though the hospital had agreed to cover some costs. Marcus's disability insurance paid only 60% of his salary, and that would run out in 6 months. Lisa had to take unpaid maternity leave longer than planned because Marcus needed care. Their savings account, once healthy, was nearly empty. They had to make hard choices. They sold Marcus's car since he could not drive anyway. They canceled their gym memberships, streaming services, and other small luxuries. Lisa's mother extended her stay to help, sleeping on their couch and watching Amara so Lisa could pick up freelance work from home. The lawsuit dragged on. David Park warned them it would be slow, but the reality was even worse than expected. Dr. Hartwell's lawyers filed motion after motion, trying to delay and complicate everything. They requested thousands of pages of medical records. They wanted to depose everyone involved. They challenged every piece of evidence. Meanwhile, the personal cost for Dr. Hartwell was mounting. His wife Diane filed for divorce after 28 years of marriage. She released a statement saying she could no longer stay with someone whose actions had harmed innocent people. She took the house in the divorce settlement, forcing Richard to move into a small apartment. His 2 adult children stopped speaking to him. His daughter Rebecca, a social worker, was particularly furious. She worked with underserved communities and knew firsthand how medical discrimination affected people's lives. She could not reconcile the father she knew with the man described in the testimony. "How could you?" she had asked him during their last phone call. "How could you look at sick people and decide they were not worth your full attention? That is not how you raised us." "You do not understand," Richard had tried to explain. "Emergency medicine is different. You have to make quick decisions. You cannot spend an hour on every patient." "But you spent an hour on white patients with the same symptoms," Rebecca said coldly. "The statistics prove it. Stop making excuses and own what you did." She hung up. Richard called back multiple times, but she never answered. His son Michael was less confrontational but equally distant. He sent brief text messages saying he needed time to process everything. Those texts became less frequent until they stopped completely. Richard told himself they would come around eventually. They just needed time. But deep down he knew he had lost them, and he knew it was his own fault. The financial consequences hit him hard too. Without his medical license, Richard could no longer work as a doctor. His pension from the hospital was frozen pending the outcome of the lawsuits. His malpractice insurance company dropped him. Legal fees were draining the money he had left. He applied for other jobs but found no one wanted to hire a disgraced doctor. Even retail stores turned him down once they Googled his name. Finally, a large pharmacy chain offered him a position as a pharmacy technician. The pay was a fraction of what he used to earn, and the work was monotonous and beneath his qualifications. But he had no choice. He needed money. On his first day at the pharmacy, Richard wore a name tag that said Richard H. and restocked shelves under fluorescent lights. Customers did not recognize him. His new co-workers were friendly but clearly did not know his history. He was just another middle-aged employee in a blue vest. The fall from grace was complete. From head of emergency medicine to pharmacy technician, from respected doctor to cautionary tale, from comfortable family life to divorced and alone. But Richard still did not fully accept responsibility for what he had done. In his mind, he was the victim of political correctness gone mad. He had made some mistakes, sure, but did not all doctors? Why was he being singled out and destroyed while others got away with worse? He thought about Angela Thompson's heart attack and told himself, that even the best doctors sometimes miss diagnoses. He thought about Marcus Williams's ruptured appendix and reminded himself that appendicitis can present in confusing ways. He had explanations for everything that absolved him of real blame. The only time doubt crept in was late at night when he could not sleep. In those dark hours, memories came back. Things he had said. Assumptions he had made. The woman whose pain he dismissed as drug-seeking when she actually had kidney stones. The teenager with a broken bone he sent home with ibuprofen because the kid seemed like a troublemaker. The elderly man whose stroke symptoms he attributed to confusion from being old. All black patients. All treated with less care than he would have given white patients with the same issues. In those moments, Richard almost understood what he had done. Almost. But by morning, he would push those thoughts away and go back to feeling sorry for himself. 6 months after losing his license, Richard experienced chest pain while working at the pharmacy. It started as pressure, like someone sitting on his chest. Then came shortness of breath. His left arm tingled. He knew these symptoms. He had seen them 1,000 times in his career. He was having a heart attack. His coworkers called 911. The ambulance arrived quickly. The paramedics were professional and efficient. They hooked him up to an EKG machine and started an IV. One of them, a young black man, asked questions about his medical history while administering aspirin. "Any previous heart problems?" the paramedic asked. "No." Richard gasped. "What medications are you taking?" "None." "Do you have a regular doctor?" Richard hesitated. "I used to be a doctor myself. Lost my license." The paramedic did not ask why. He just nodded and continued his work, treating Richard with the same care he would give any patient. Even when he surely could have looked up Richard's name and learned what he had done. The ambulance took Richard to St. Augustine Medical Center. The irony was not lost on him. This was the hospital where he had worked for 25 years, where he had dismissed Marcus Williams and sent him home to nearly die. They brought him through the same emergency room entrance where Marcus had collapsed, past the same waiting area, through the same halls. The hospital staff did not recognize him at first. Why would they? He was just another patient now. They took him to a cardiac unit and ran tests. The doctor on call was Dr. Sarah Chen, the resident who had tried to help Marcus against his orders. She looked older now, more confident. She had been promoted after the investigation and now worked as an attending physician. When she saw Richard's name on the chart, her expression did not change. She was professional. She examined him thoroughly, ordered all the necessary tests, and explained everything clearly. She did her job exactly as she had been trained to do. The test showed Richard was having a moderate heart attack, not severe but serious enough to require immediate treatment. Dr. Chen admitted him and called in a cardiologist. They gave him medication to dissolve the clot and scheduled a cardiac catheterization for the next morning. Richard lay in the hospital bed, surrounded by beeping machines and IV poles. The same kind of bed where Marcus had fought for his life. The same hospital gown. The same uncertainty about the future. A nurse came in to check his vitals. She was older, maybe in her 60s, with gray hair and gentle hands. She adjusted his pillow and made sure he was comfortable. "Is there anyone you want us to call?" she asked kindly. "Family?" Richard thought about his ex-wife who would not care, his children who were not speaking to him, his former colleagues who had all distanced themselves. "No," he said quietly. "There is no one." The nurse patted his hand sympathetically and left. Richard stared at the ceiling, feeling more alone than he had ever felt in his life. The next morning, Dr. Chen came to see him before the procedure. She stood by his bed reviewing his chart on a tablet. "Mr. Hartwell, the catheterization should be straightforward. We will go through your wrist, find the blockage, and place a stent if needed. You will be awake but sedated. The recovery is usually quick." "Thank you," Richard said. Then, because he could not help himself, "You do not have to treat me, you know. After what happened with Mr. Williams, I would understand if you refused." Dr. Chen looked at him steadily. "That is not how medicine works. Every patient deserves proper care, regardless of who they are or what they have done." I took an oath. You should remember that oath too. The words hit harder than any punishment the medical board had given him. This young doctor, whom he had dismissed and belittled, was showing him what real professionalism looked like. She was treating him with the care and respect he had failed to give so many patients. "I am sorry," Richard said suddenly. The words came out before he could stop them. "For what I did to Mr. Williams, for everything. Dr. Chen studied him for a moment. "Tell that to Mr. Williams and the others you heard." "Not to me." She left to prepare for the procedure. Richard lay there feeling something crack inside him. Not his heart, which was already damaged, but something deeper. The wall of denial and self-justification he had built around himself. For the first time since this all began, Richard Hartwell let himself truly face what he had done. Not just to Marcus Williams, but to Angela Thompson, Deshaun Miller, and countless others whose names he did not even remember. People who had come to him in pain and fear, trusting him to help. People he had failed because of his own prejudices and biases. The tears came then. Not tears of self-pity, but of real remorse. He cried for the first time in decades, lying alone in a hospital bed, finally understanding the harm he had caused. The procedure went well. They placed a stent in his blocked artery, and his prognosis was good. He would need medication and lifestyle changes, but he would survive, physically at least. As he recovered, Richard made a decision. He could not undo the past. He could not give Marcus Williams back his health or Angela Thompson the years she lost recovering. But maybe, just maybe, he could use what remained of his life to do better. When he was discharged 3 days later, Richard went home to his empty apartment. He sat down and wrote letters. To Marcus and Lisa Williams. To Angela Thompson. To Deshaun Miller. To every patient he could remember harming. The letters were not excuses. They were simple, honest apologies. He acknowledged what he had done. He took full responsibility. He did not ask for forgiveness because he knew he did not deserve it. He just wanted them to know that he finally understood. Most of the letters went unanswered. But writing them was not about getting responses. It was about facing the truth and taking the first small step toward becoming a better person than he had been. 6 months after his heart attack, Richard Hartwell sat in a courtroom as the civil lawsuit finally reached trial. He was there as a defendant, watching as David Park presented the case against him in St. Augustine Medical Center to a jury of 12 citizens. The trial lasted 3 weeks. Marcus Williams testified first, describing his experience in careful detail. He had regained most of his strength by now, though he still tired easily. He wore a dark suit and spoke clearly, looking directly at the jury as he explained what happened that terrible night. He left the hospital and drove home. Lisa and Amara were waiting. His daughter, now walking and babbling constantly, ran to him when he came through the door. Marcus picked her up and held her close, breathing in the smell of her baby shampoo. This was what mattered. Not the money from the settlement or the satisfaction of seeing Dr. Hartwell lose everything, not even the systemic changes, though those were important. What mattered was that he was here, alive, holding his daughter, building a life that meant something. The trauma would always be part of his story. The physical scars on his abdomen would never completely fade. The emotional scars would take even longer to heal. But he had survived. His family had survived, and they had turned their pain into something that might prevent others from suffering the same way. That evening, Marcus sat with Amara on his lap, reading her a picture book. She could not really understand the words yet, but she loved looking at the colorful pictures. Lisa sat beside them, her hand resting on Marcus's shoulder. "Daddy?" Amara said one of her few clear words. She patted his face with her tiny hand. "Yes, baby girl. Daddy is here." Marcus kissed her forehead. "Daddy is always going to be here." He looked up at Lisa. She smiled at him with a mix of love and shared understanding. They had been through hell together. They had come out the other side changed but not broken. In another part of the city, Richard Hartwell sat alone in his apartment. The letter he had written to Marcus months ago sat on his desk, returned unopened. He did not blame Marcus for not reading it. Why would he? Richard had started volunteering at a free clinic in a low-income neighborhood, doing whatever work they would let him do without a medical license. Filing paperwork, checking people in, cleaning exam rooms. It was not practicing medicine, but it let him be around healthcare and maybe do some small good. The clinic director, an older black woman named Dr. Patricia Johnson, had been skeptical about letting him volunteer. She knew his history, but she also believed in second chances and she needed help. "You will never practice medicine again," she had told him bluntly. "But if you genuinely want to serve this community, to make amends in whatever small way you can, I will give you that chance." One mistake, though. One hint that you have not really changed and you are gone. Richard had agreed. For 6 months now, he had shown up every Saturday to volunteer. He did humble work without complaint. He treated every patient he encountered with respect and dignity, even though he was not treating them medically. It did not make up for what he had done. Nothing could. But it was something. A small attempt to use what remained of his life for good instead of harm. He would never get his old life back. Never practice medicine again. Never regain the respect of his children or former colleagues. But perhaps in time he could become a person he did not completely hate when he looked in the mirror. That would have to be enough. Back in his living room, Marcus put Amara to bed. He stood over her crib for a moment, watching her sleep. Her tiny chest rose and fell with each breath. So perfect, so innocent, so full of possibility. She would grow up in a world that was still imperfect, still struggling with racism and inequality. But maybe, just maybe, it would be a little bit better because of what her parents had fought for. Marcus kissed his fingertips and touched them gently to Amara's forehead. Sleep well, little one. Tomorrow is a new day. He turned off the light and left the room, pulling the door partly closed behind him. Lisa was waiting in the hallway. She took his hand and they walked together to their bedroom, ready to rest after a long day and wake up tomorrow to keep building the life they had fought so hard to preserve. The fight for justice had been long and painful. But they had won. Not perfectly, not completely, but enough to move forward with hope instead of bitterness. And sometimes that was the best victory you could ask for. Lisa testified next, describing her terror as she watched her husband collapse. Then came Angela Thompson, Deshaun Miller, and 6 other former patients. Each told their story. Each described being dismissed, ignored, or inadequately treated by Dr. Hartwell. The statistical evidence was presented by expert witnesses. Charts and graphs showed the clear pattern. Black patients waiting longer, receiving less thorough care, being sent home at higher rates without proper testing. The numbers did not lie. Dr. Sarah Chen testified about what she witnessed in the emergency room with Marcus. Nurse Jennifer Parks described the pattern she had noticed over years of working with Dr. Hartwell. Former colleagues spoke about racist comments he had made in private. Dr. Hartwell's lawyers tried to defend him. They argued that emergency medicine requires quick decisions under pressure. They brought in their own experts who claimed the statistical differences could be explained by various factors. They suggested that some of the former patients were exaggerating their symptoms or misremembering events, but the evidence was overwhelming. When it came time for Richard to testify, he took the stand knowing that everything he said would be judged by the jury, the press, and history. His lawyer had coached him to stick to medical explanations, to defend his clinical decisions, to avoid admitting fault. But as Richard sat in the witness box looking out at the faces of the people he had harmed, he could not do it anymore. Dr. Hartwell, his own lawyer, began, "Can you explain your treatment decisions regarding Marcus Williams?" Richard was supposed to say that Marcus's symptoms were ambiguous, that food poisoning was a reasonable diagnosis. That hindsight is always clearer than real-time decision-making. Instead, he said, "I barely examined him. I made assumptions based on his race. I failed to do my job as a doctor, and he nearly died because of it." The courtroom went silent. Richard's lawyer looked shocked. David Park leaned forward, surprised but pleased. In the gallery, Marcus and Lisa exchanged glances. "Dr. Hartwell," his lawyer tried again, "perhaps we should clarify what you mean." "No," Richard interrupted. "I need to say this to all of you." He looked at the jury, then at Marcus and the other former patients. "I let my prejudices affect my medical judgment. I convinced myself I was being efficient, but the truth is I gave less care to black patients. Because on some level I did not value their pain and suffering as much as white patients. That is the truth, and I am deeply ashamed of it." The trial continued, but Richard's testimony changed everything. The jury deliberated for only 4 hours before returning with their verdict. They found both Dr. Hartwell and St. Augustine Medical Center liable for medical negligence and discrimination. The damages were substantial. Marcus Williams was awarded $3 million. Angela Thompson received $2 million. The other plaintiffs received amounts ranging from $500,000 to $1.5 million, depending on the severity of harm they had suffered. The hospital's insurance would cover most of it, but Dr. Hartwell was personally liable for $1 million to Marcus. It was money he did not have. He would be paying it off for the rest of his life. But more important than the money was what the verdict meant. It sent a message that racial bias in healthcare would not be tolerated, that doctors who discriminated would be held accountable, that patients deserved equal care regardless of their race. Outside the courthouse, reporters surrounded Marcus and Lisa. Amara, now 9 months old, sat on her mother's hip, looking curiously at all the cameras and lights. "How do you feel about the verdict?" a reporter asked. Marcus thought carefully before answering. Justice is not just about money. It is about acknowledgement, about making sure this does not happen to anyone else. Today we got both. So yes, I feel good about this verdict. What do you want people to learn from your experience? That your pain is real. Your symptoms matter. If a doctor dismisses you, get a second opinion. Advocate for yourself. And if you see injustice happening to others, speak up. Dr. Chen and Nurse Park spoke up for me. They saved my life. We need more people like them. Lisa added, "We also need systemic change. St. Augustine Medical Center has agreed to implement new policies as part of the settlement. Mandatory bias training for all staff. An independent patient advocate office, tracking demographic data on treatment decisions. These things will help, but every hospital needs to do this. Not just because of lawsuits, but because it is right." As part of the settlement, the hospital had indeed agreed to major reforms. Dr. Chen was promoted to head a new Department of Health Equity, tasked with identifying and addressing disparities in patient care. Nurse Parks received a commendation for her bravery in speaking up and was given a role in training other nurses about recognizing bias. The changes at St. Augustine became a model for other hospitals. Medical schools across the country added new curriculum on implicit bias and cultural competency. The case was studied in ethics classes and used as an example of how individual prejudice could become institutional failure. Marcus slowly rebuilt his life. The settlement money meant he could pay off all his medical bills and have enough left to support his family while he continued recovering. His architectural firm offered him his old position back, but Marcus decided to do something different. He became a patient advocate and public speaker. He traveled to medical conferences and community centers, telling his story and educating people about healthcare discrimination. He worked with nonprofits focused on improving healthcare access and quality for underserved communities. The work was meaningful in a way his architecture career had never been. He was using his experience to help others, to prevent what happened to him from happening to someone else. Lisa supported him fully. She had gone back to her job as a graphic designer part-time, working from home so she could be with Amara. They were not wealthy, but they were stable. More importantly, they were happy. The trauma had not destroyed them. It had, in some strange way, shown them what really mattered. 1 year after the trial, Marcus was invited to speak at a medical ethics seminar at St. Augustine Medical Center. He walked through the same halls where he had nearly died, past the emergency room where Dr. Hartwell had dismissed him, up to a conference room where 200 medical students, residents, and staff gathered to hear him speak. As Marcus walked to the podium, he passed someone in the hallway, an older white man in a pharmacy technician uniform, restocking a supply cart. The man looked up, and their eyes met. It was Richard Hartwell. For a moment, neither man moved. The hallway felt frozen in time. All the pain, the anger, the consequences, everything hung between them in that brief look. Richard opened his mouth as if to speak, but no words came out. What could he possibly say? Sorry seemed inadequate. Too small a word for such large harm. Marcus looked at him steadily. He saw a broken man, someone who had lost everything and was trying to survive doing menial work in the hospital where he once commanded respect. Part of Marcus felt satisfaction at that justice, but another part, a part he had not known existed, felt something closer to pity. Marcus did not say anything. He simply nodded once, not forgiveness exactly, but acknowledgement, and kept walking. Richard watched him go, then returned to his cart. He would spend the rest of his shift restocking bandages and IV supplies, tasks that required no thought and left too much time for reflection. This was his life now. This was what he deserved. In the conference room, Marcus delivered his speech. He told his story honestly and completely. He talked about the night he almost died, about waking up days later to learn how close he had come, about his daughter being born early because of the stress on his wife. But he also talked about hope, about Dr. Chen and Nurse Parks who stood up for what was right even when it was hard, about systemic changes that were making a real difference, about the medical students in this very room who represented a new generation that would hopefully do better. "You will all make mistakes in your careers," Marcus said, looking at the sea of young faces. "Medicine is complex and you are human, but there is a difference between honest mistakes and mistakes that come from bias and prejudice. The first happens despite your best efforts. The second happens when you stop trying, when you make assumptions based on stereotypes instead of symptoms, when you give less care to patients who do not look like you." He paused, letting his words sink in. Every patient who comes through those emergency room doors is someone's husband, wife, child, or parent. They are scared. They are in pain. They are trusting you to help them. Honor that trust. See them as full human beings worthy of your best effort. Always. No matter what. The room was silent when he finished. Then someone started clapping. Others joined. Soon the entire room was standing, applauding. Some of the students had tears in their eyes. After the seminar, several students approached Marcus to thank him. A young black woman, a second-year resident, shook his hand firmly. "Thank you for sharing your story," she said. "I have had patients who told me other doctors did not listen to them. I always believed them, but now I understand better. I will do better because of what you taught us today." Marcus smiled. "That is all I can ask for."